So if you have been playing in my playground for more than a hot minute, you know how much I love Russ Rosen because I'm constantly name dropping him because he's such a big deal in my world. Russ, I'm so happy you're here.
Me too. Always great to be with you.
Tell me, if I never knew you and I was a wellness practitioner looking to automate my systems and get my shediggles together, who are you and where do you fit in?
I am a I'm a coach for natural healthcare providers who want to help their patients get healthy and stay healthy for a lifetime versus just getting them out of pain. I don't have any problems with that, and I see someone just from my shoulder, but I work with people who want to help their patients get healthy and stay healthy for a lifetime, and we have systems in place to empower your patients to want that from you.
And you know what, you guys, the coolest thing about it is that's really what he does. Like, you know how you meet leaders and coaches and mentors and they're like, I do this, this, and this. After working with Russ for years, Russ, you taught me how to educate my practice members, and I still use everything you taught me in my everyday practice. So tell me about the importance of certainty. Tell me, why do we need to even consider the importance of certainty when it comes to educating new practice members or patients or clients or whatever you call them?
Yeah, look, that's a huge issue here. So one of my superpowers is I look at headspace and procedures. And the procedure, somebody says, I would like to get more referrals. And I go, ask these 3 questions. And they go and ask the 3 questions and they don't work. But their headspace is, I'm a doctor, I shouldn't have to ask for referrals. So there's no power behind their punch. It's a white belt hitting a brick and they break their hand versus a black belt hitting a brick and they break the brick. Your certainty about who you are, what you do, what you don't do, why you do what you do, why you don't do what you do, what you believe you can accomplish with people, what you acknowledge you can't. All of those things lead to the power behind your punch. So regardless if you're asking for referrals or if you're telling a patient a care plan or whatever it is, if you're not clear and congruent, they feel that, right? So you remember in Jerry Maguire, little kid said, did you know that dogs and bees smell fear? Right? That was my nephew in Jerry Maguire, Jonathan Lipnicki.
Really?
Yeah. It is true. Dogs and people, and they smell fear and they smell incongruence. There's just no power behind your punch. So we know there are practitioners, gruff old farts that don't have great communication skills, but they so believe in what they do,
Right.
that they just tell you what to do and you do it. Well, if you can imagine having that kind of certainty because you know that you know that you know, and you have the skill set, the neuroscience of communications, you understood how to communicate with your people so they truly got what you did and wanted what you offered. Now you put those together and you have a legendary Dr. Jodi Dinnerman type of practice.
So okay, I want to unpack that a little bit. Let's talk about the new practitioner, just graduated school, scared shitless, doesn't have a pot to piss in, right? Is unsure about everything. And the only thing they're sure about is how unsure they are. Do they act as if, or do they just learn, like, do these 3 things?
Yeah, look, I have a particular process. It's in your school too, called the importance of certainty. And it walks people through getting that clarity of what their actual truth is. So here's what happens. You go to a seminar and it's rah, chiropractic, naturopathy, osteopathy, nutrition, whatever heals everything, right? Then you go home to your practice and you recognize there's some people that aren't coming along as I would hope, right? If you're being honest with yourself, because no one gets perfect results with everybody. If you could, you'd walk on water, right? I haven't been able to do that yet. So when you recognize that, wow, these people aren't coming along, but the work I do is supposed to help everybody get there, one of 2 things are true. Either chiropractic, naturopathy, osteopathy, whatever is a lie, or I suck, right? Neither of those leads to building a great practice. Or I can just be honest. I can just be honest with myself and with my patients. Look, my best estimate is this is probably what you're going to need. I'm going to monitor it over time. I don't have a crystal ball. Be honest with people. I'm not saying use weasel words. I'm just saying be honest with them. When you are clear about who you are and what you do, and you come from a place of honesty, you can swing for the fences. One of the things, and I know you do this in my consult, is I tell people, my goal is to make sure you're in the right place to get the care that you need. My promise is I'm going to help you. I'm either going to be the right guy for you, or for some reason I don't think I'm the right guy, I'll do everything in my power to get you to someone who can help
But
you.
I won't waste your time or your money.
I'm going to waste your money, right? So I'm honest about that. And when I show them a care plan, I tell them I have a 3-visit rule. This is my rule. You get to do what you want. If I don't see the pattern shifting, if you come back with the same thing 3 times in a row, we ought to stop.
Right.
Because what I'm doing isn't working. Because innate wisdom, if I do the right thing and you do the right thing, we're going to see progression. I'm not saying that their headaches are gone or that they regrew a limb. I'm just saying that pattern wise, they're moving in the right direction. So I'm honest about what I expect to see. I'm very clear when I give them their recommendations during this period of time. This is what I expect. And here's how we're going to know. These are the tests I expect to see. This is how I expect you to feel. By this period of time, this is what I expect. And any time along the way, and we do reevals along the way, obviously, anytime along the way we're not seeing that happen, you need to do something different. Eat better, exercise, deal with stress. I need to do something different. See you more often, less often, different technique. We need to do something different, or I got to refer you out. So if you can come from that, now can you swing for the fences? Yes, because you're clear about what you expect and you're honest about it. And you let them know if this doesn't go this way, then. Because what happens is people are afraid to tell the truth or what they believe to be true. Because what if I'm wrong? What if I'm wrong and then I see them in the store? Then they're going to hate me and think that I was a liar and I was trying to rip them off. And now I have no power behind my punch. What if I'm dishonest? Here's what I expect to see. Here's how we're going to monitor it. Now you do your best, I'll do my best. We're either going to get results. And if we don't, we'll figure out why, or I'll refer you out.
Do you have any, so I'm thinking for the new practitioner or the practitioner who's rebranding themselves. Do you have any tips on how to find what those measuring parameters are?
Yeah, here's the deal. It's so much profession and technique dependent. So specifically in this moment, I'm just going to say chiropractic, but I coach naturopaths and osteopaths, medical doctors, all that kind of stuff. But as far as chiropractic goes, step one, really understand what a subluxation is and isn't. So most people don't understand that. I have a whole hour on that subject of truly the quantum understanding of what a subluxation is, and then and how a subluxation affects the system. Once I understand that, the next question is, how would I measure that?
So if it's that's chiropractor. If it's a massage therapist, it would be really understand what a pattern of tension in the muscular system is, and then how to measure that. If you're a nutrition practitioner, really understand what unhealthy parameters with nutrition are and how to measure them, right?
Right. Yeah, like if I'm doing nutrition, I might be doing spit, pee, and poop tests. I might be doing blood work. I might be doing like whatever it is I do. I have to have ways of objectifying what it is that I do. It could be leg checks. It could be palpation. Like it doesn't matter. Whatever it is that you're trying to accomplish, you need to clarify. So here's the deal. If I'm with a dentist, dentist says you have a cavity. Great. Take a picture. There's a cavity. Drill, fill, and build. Boom. It's fixed. They have a way of measuring that. Well, here's the problem with chiropractors. Number one, they don't really understand what a subluxation is, right? They think that it's some physical thing. It's a state of being, right? It's if you think that it's a bone out of place, you're missing the boat, right? It's much more than that. It's much more global than that. It's a state of disapparentation, disapparentation, and you can measure that in many different ways. In fact, tell me any physiological anything that wouldn't measure an effect of a subluxation. So if I was checking acupuncture pulses, could that measure the effect of a subluxation? Yes. Could a spit, pee, and poop test measure the effect of a subluxation? Yes. Could an x-ray measure the effect of a subluxation? Yes. So when you understand what it is that you do, right? Subluxation, detox, nutrition, what it is I do, how I measure what it is that I do, and then when I do the work I do, how I see if it's accomplishing what I meant to accomplish. Now I have certainty that I'm doing what I said I would do,
Right.
versus pop and pray, or versus I'm just going to give you these nutrients, and because this line said it would do this for you, I know it will. Nonsense. You're a doctor, you're a practitioner, you owe it to yourself and to others to have ways of measuring the truth. I'm accomplishing what I meant to accomplish or not.
And they really, I remember maybe 10 years ago, I was stuck on this for months with you. Like I could not figure out, I never felt connected to reevaluations because I felt like things were so arbitrary with the body, and like, could I really measure something on the body? Like I really went there. So I think if we can just attach or grab onto a few things that you can measure within your scope of practice, and they might be different than what you're taught to measure in school, and just let them be your building blocks for the knowing that you need to say, I'm either helping this person or I'm not helping this person. And then having the humility to say, I'm not helping, you got to go to the guy down the street.
Yes.
Or having the wherewithal to say, wow, look at how I'm helping you. Who do you know who could also use this help?
Yeah, and so on this level, who do you know who could help us take it to the next level? Because I look at whatever it is I do as part of a team. I'm not
Right.
the only one. That's just ridiculous, right? There was a time in practice where I thought I was the only one, right? I did nutrition, I did neuroemotional work, I did all that kind of stuff. It's just ludicrous. I'm a part of the team, right? But when you have the certainty, you break the brick. But if I'm afraid to look, and the Achilles heel of all of these natural healthcare providers is the reeval report. That's the Achilles heel, because I don't really know. So if I just pop and pray, and I trust the philosophy that I'm going to trust and trust, right? I'm going to trust and trust, and I trust that innate wisdom. Shut up. Like, it's just ridiculous. Is it possible that what you're doing is not having the effect that you were planning? Yes. Is it possible that they're doing something? They're banging their head against the wall. They go home, they bang their head against the wall. Is your adjustments, is your nutrition, is that going to help resolve this problem? No, they're still banging their head against the wall, right? So they have to do their part, eat better, exercise, deal with stress. I need to do my part. We need to monitor. And then the vast majority of the time, we're getting great results. But if we're not, we don't just have the humility, we have the ethics to be honest with them. And when we do that, and we refer them out. In fact, I would challenge you to make a list of people you're concerned you're not getting results with.
Right.
Go and ask them and say, listen, I'm concerned with what I'm seeing. How about you? I'll bet you 6, 7 out of 10 are going to say, don't quit on me now.
Right.
You're the only one who's ever helped me. But the few who look at you and say, thank you, I'm concerned too. Now you can dive into, you eat better, exercise, deal with stress. I come up with a different protocol for you, or we get you to somebody else. And if I'm going to do that, and I've only done it a couple of times because normally we get this stuff straightened out, I would tell you, Jodi, here's the deal. I love you. I want you to get results. What I'm doing isn't the right thing for you. Why? No idea. Doesn't matter. I'm going to make some calls tonight. I'm going to call 3 different practitioners that I know, and I'm going to talk to them about what's going on with you. And I'm going to get back with you and tell you who I want you to go see. You're going to go see them, and then you're going to call me. Here's my cell number. You're going to call me and let me know if you feel you're on the right track. If so, fantastic. Month down the road, I want to know you're doing better. If not, I will not quit till I do everything I possibly can and exhaust every single person that I know. Does that sound fair to you, Jodi? Now, I've done that to a handful of people, and most of them still referred to me, and I didn't help them, but I did help them because I referred them out. Right? I don't have to be the one. I don't have to be the one to walk on water. Right? I said my goal is to make sure you're in the right place to get the care you need. I'm going to help, even if it means I refer you out. Well, now that's much bigger. That's much easier. And you see the pressure it takes off of me. So now I'm not afraid to look at the reeval. I'm excited to look at the reeval because we're either getting results or not. It's just a completely different mindset.
Right. And one of the things that you said there is, does that sound good to you? And if you guys don't know where to start, if this is way over your head, what we're talking about, if the one thing you take away from what you're hearing right now is you ask your practice members, does that sound good to you? After you teach them something or tell them something, or say to them, what did you hear me just say to you? Or how do you interpret what I just said to you? And you're going to learn so much from their response. You're going to catch them, right? And you're going to catch them where they're at, and you're going to hear where they're at, and it's going to give you another layer of perspective into how to serve them.
Absolutely.
Russ,
And let me
what,
just
oh, go ahead.
let me comment on what you just said. So we
Yeah.
do listen, acknowledge, ask, solution, resolution. It's not just a solution that I got to tell my patient what I think. It needs to be resolution, that they've heard it and they feel good about it. Because
Right.
we tell people all the
You need
time,
to be in agreement.
yeah, and they're like holding up garlic and crosses and like, but they shake their head. I want to make sure there's resolution, or they're not going to make long-term change.
I love it. I love it. What if somebody needs to know more about Russ Rosen and the world that you're in and what kind of greatness you're dishing out? What do they do? Where do they go?
www.the, so THEOHC system, so optimal health coaching system.com/Jodi. If you go to that, I put together a special page for you where you get a bunch of stuff. I'll tell you what, if you go through my my program that I have on there for free, 86-minute program on communications, you'll get it, and you'll go, I dig this guy and I really want more, or not so much.
Yeah.
And I put a bunch of other stuff on there for you too.
Awesome. Thank you. Let me ask you this before we say goodbye for now. If one of your people or one of your friends or colleagues came up to you and said, I'm really considering Dr. Jodi's Staffless Practice Success System. I'm thinking about grabbing a seat to soup school. I'm just not quite sure. What would you say to them?
Well, the first thing I would do, I would ask them why. And if they said anything along the lines of, like if they said, because I want to jump higher, I'd say, this isn't for you. I want to surf better. Well, this isn't for you. If they said, I want to run a staffless practice, I want to automate as many things as possible so that I'm not running around like a chicken with my head off. I don't want to try and reinvent the wheel. I'd rather just find somebody who has a system in place that I can just go in, pick and choose what's going to be best for me and fully integrate. If they said that, then I would say, do it. Just do it. If that's what you're looking for, this will do it for you. Again, if you're looking to, learn how to play guitar, this isn't the right place. So if that's what you're looking for, if you're looking for an automated system, somebody who's already thought these systems through, and I've had the pleasure of working with Jodi for many, many years, for coaching her and also learning from her along the way, so many different things. She is absolutely brilliant when it comes to organizing systems, when it comes to these kinds of things, taking it to the next level. You guys don't know all the stories that I know about Jodi, but I've watched her take different things, and she comes up with this crazy idea, right? And then actually, brings it to fruition. The program that she's put together is absolutely brilliant. And again, if you're looking to automate, if you're looking to not reinvent the wheel, then do it. For the price, you just can't lose. If you got one or two of the dozens of things, it could change your whole life, your whole practice. And even if you didn't make any more money, which you will, it would bring you more joy and less anxiety and more freedom in your life. It's worth the lousy, $3,000? I mean,
That's fun.
That would be my route.
I always say that the content that Russ Rosen has contributed to Soup School alone is worth its seat and then some. So you're always my favorite. I appreciate your time. Thank you so much for playing in my playground for a short time. And I hope that this goes everywhere and so many different people hear it, because it was super helpful. Peace out.